Good evening to you all.
Good evening, sir.
Good evening, sir.
Good evening.
Good evening.
Good evening. How are
Good
you
evening.
all?
We are all
Good evening,
fine.
sir.
Thank you.
Good evening. Good evening. Good evening.
By
Very
the grace
soon,
of God, we are doing fine.
yes, we thank God. Very soon, I'll open my video so that we can see each other for the first time, so we can build on from there. So you see the person who is teaching you, and I also see sometimes if you open the video, it consumes a lot of credit. So we, after seeing each other, I mute the video and then we move on. We have a marathon to take, and this course is a marathon. And I welcome you for the first time using some of you using Zoom apps to learn from a distance. I welcome you to Garden City University, and I welcome you to medical nursing, medicine and medical nursing department. And I am there more or less as the resident lecturer for medical nursing. We have other lecturers in addition to myself. So you are lucky to meet me. I'm lucky to meet you as well. For the first time, we want to set the rules and then we keep going. The rules, or the rule number one, is that as soon as you connect your gadgets to the link and the link opens up, please mute your microphone and your video. You may, unaware, be taken by surprise that your conversation, which could be private, is everybody's consumption. You may be saying something very sensitive, and it will be out there for everybody to enjoy. Meanwhile, it's for only you and your husband, or for only you and your wife. But that message or that conversation is out there for everybody to consume. You may be in a position where you have exposed yourself, and unfortunately, you may leave your video on. And mind you, some people forget when they are eating, their video will be on. And it's like in a classroom where you have brought food and lectures are going on and you are eating for everybody to see. So take this app as a classroom setup, where anything that you do will reflect as if you are in a classroom. You may have exposed yourself like the ladies, maybe with a single cloth and all the top is exposed. And you have connected. You think you are in the house alone. You are not in the house. You are in the classroom and everybody is looking at you. I remember during the COVID time where we had a lecture, then a student connected, and that student was in boxer shorts, with a very big bowl with fufu in front of him, and eagerly listening to lectures. So whatever you do here on this app is suggestive enough to show that you are in a classroom and you are doing it to your class for people to see and to hear. One very nostalgic moment occurred where a lady was lambasting the husband, and it was so bad. The words were so offensive. The words were so offensive. I, on the Kwasia, Jimmy, he'll come and meet me. Oh, so bad, so bad, so bad. And that time we couldn't have the lecture. We have to suspend the lecture. Everybody was bad. So please, you are new. If you don't know how to navigate your ways through the app, please let somebody teach you. Before you disgrace yourself, let somebody teach you. There's no shame about it. Let somebody, please. I am not comfortable with the app. Can you teach me? The person will teach you. Once you join, I think we have somebody who has forgotten or who have forgotten to mute. just as I'm saying, person has forgotten to mute the microphone. Jonas, Yintio, Jonas, Apia Kubi, and Jonas. Something I'm just on it talking. You are repeating it. I'm just talking about this. That's anytime you connect, mute your microphone. Apia Kubi is still unmuted. iPhone 111798. This is what I don't like. Who is iPhone 111798? Who is it? Connect with your name so that if anything, we can trace you. Connect with your name. When you connect, it shows write your name there. Please, class rep, I will leave the rest for you to carry on, else it will take all our time. I saw the class rep trying to discipline somebody who left the microphone on, and there was so much noise at the background. And I think the class rep is doing very well, even though I don't know you for the first time. I saw it, and I was happy you were trying to discipline the person. Anybody who misbehaves, please. We are having an adult class. Please, let us behave ourselves so that we can have a smooth lecture. Thank you very much. The rule number 2, no absenteeism. If you think that it is Zoom and therefore you can go scot-free, you lie bad. I have all the participants here. All the participants. Now I have a total of 545. It's still counting. 546. The 46th person is trying to connect. It's moving to 550. It's now 550. So people are connecting. So by the end of the lecture, I will stop and then capture the attendance. So please don't exempt yourself from lectures. At least participate in the live lecture. So later, when the recording is given to you, you will not be an alien to whatever transpired. So please, no absenteeism. That is why the university has given you the leverage to connect to lectures at your convenience. So there is no excuse for you to exempt yourself from lectures. And the course you are doing for medical nursing 1 is so compelling. Very, very compelling. It will compel you to think through and to apply so many things you have learned in physiology here and there to understand. Basically, it's biochemistry you are going to learn. It's full of ions here, chemical equations here and there, bringing your chemistry to bear. And I would advise you to give in your all. This is your last chance to understand what you did not get from the diploma level. This is the platform for you to showcase and fill the gaps that you left at the diploma level. So no room for complacency, no room for absenteeism, no room for indiscipline. So we can have a very smooth lecture. I don't miss lectures because the content is enormous for me to miss lectures. I don't miss. I even want some more weeks to be added so that I can finish my content very well. Because if I want to explain one point, it takes so much time for you to understand, and therefore I can't move as fast as I want. I don't miss lectures. Today marks the first day, going to take you through the course introduction, then we carry on. Today's date is what?
Second February.
2nd of February. 2nd February. Thank you. Yes, 2nd February. So mark it on your calendar. We started the lecture on the 2nd of February. And we are going to have a very smooth lecture. Thank you very much. So we are doing medical nursing 1. Sorry, it's not medical nursing 2, it's medical nursing 1. So if you have seen medical nursing 2, it's not 2. You do medical nursing 2 when you are in 2nd semester. So this is medical nursing 1. Okay. And we are doing that. Your course code is 321, 2 credits. And I'm in the person of ANTWI. And my email is here. My telephone number is there. So if you want to reach out to me after this lecture, I would want the class rep to create a unique platform for January Medical Nursing 1 CODeL students 2025. Look at the name I'm giving to the WhatsApp page. CODeL January batch, Medical Nursing 1 2025. CODeL Medical Nursing 1 January batch. We have so many CODeL students, different batches, doing different courses. So you are CODeL January batch, Medical Nursing 1, and the year is 2025. That is unique to this particular platform. That is where I will send all the course content. I will send all the course out, everything. The lecture notes, everything to you. So we have Unit 1. We are discussing physical assessment of clients with fluids and electrolytes and acid-base imbalance. You see, normally it is those who don't join early, those who join late. Those are the people who make those indisciplined behavior because they are not there to listen to what transpired. So they will join with their old ideas and they will join with their ignorances and then trying to create chaos. So if you see anybody creating chaos, it is those who have just joined because they don't know what has transpired. That's it. So let me go on. So here we are doing physical assessment of clients with fluid and electrolyte imbalance, acid-base imbalance, overhydration, dehydration. We will talk about isotonic solution, hypertonic, hypotonic, heat stroke. Okay, for the first time, let me put my video on so I can see you and you can see me as well. I don't know IT, if the IT people can. Yes, so in the course of the lecture, hello, can you hear me?
Yes,
Yes,
sir, we can
sir.
hear you.
Yeah, we can hear you.
Yes, sir.
Very good. Very good.
Yes, sir.
Yes, so I just want to share.
Yes, sir.
Yes, I just want to open my video, but I don't know what's happening to the IT people. I can't access the video button. So let's move on. So we have clients who are going through fluid volume imbalance, and we are looking at solute excess, solute deficit, metabolic acidosis and alkalosis or alkalosis, respiratory acidosis or alkalosis, fluid and electrolyte supposed to be imbalance. So fluid and electrolyte imbalance. We are looking at edema. So the imbalance may create edema or may create dehydration. If you are talking about acidosis and alkalosis, then we are talking about preparation and administration of intravenous therapy. So that is what we do at Unit 1. Then we look at so we are looking at Unit 2, causes of fluid and electrolyte imbalance. So acidosis and alkalosis, we're looking at the causes. Then we are also looking at okay, so I think I have connected you and I have identified the problem. So we will not have issues again. Let's move on. So we are going to have Unit 2, and that unit is going to deal with causes of fluid and electrolyte imbalance, acidosis and alkalosis. Unit 3 is going to deal with features of dehydration, overhydration, electrolyte imbalance, and acidosis and alkalosis, compensatory mechanisms associated with isotonic and hypertonic dehydration, risk factors for dehydration. We're going to look at intravenous for clients with fluid and electrolyte imbalances, client history, physical examination, skin color, moisture, TEGA, weight, urine output, vital signs, everything is there. I don't want us to go through one after the other. So the course content will be shared to your platform when you alert me that you have created that platform. And I'll put it there for you to access. So end of semester is graded as 30 and then, 70, and then the mid semester is 30. So you know you have 100%. Your materials for referencing are here. So these are the reading materials. I think it's quite old. We have the new ones. I will paste the new ones there for you. So you can go to the net and access the books and read on the net. So you can update the lecture notes is just a skeleton. So you have to research more and read more around so that you can have more insight. Okay, so that is what we want to go through about for today. Okay, so you have fluid electrolyte imbalance. So first we have definition of fluid volume deficit. We are going to look at deficit first. Then when we are done with the deficit, we look at the excess. So fluid volume excess and fluid volume deficit. But the first, we're going to look at the excess or the deficit, sorry. I was having a network challenge and I needed to update some of you. Yes. Okay, so now it's stable. So let's move on. So when we mention FVD, then we know that we are looking at fluid volume deficit. And how does it result or how does it come about? FVD comes about when water and electrolytes are lost in the same proportion as they exist in the normal body fluids, so that the ratio of serum electrolyte to water remains the same. So let's assume that you have 100 ml of water and 100 grams of salt within the body. As you lose 20 mils of water, you lose 20 grams of salt. So at in time, the amount of salt and then the amount of fluid that you lose is the same. So whatever is lost and what remaining, the ratio remains unchanged. So the ratio of serum electrolyte to water remains the same. The same amount of water is lost, the same amount of solute is also lost. And the same amount of fluid remains, the same amount of solute remains. Somebody hand is up. Okay, Benjamin. Benjamin Adu, your hand is up.
Sir, please. Good evening. I'm the course reporter. Please, I don't know if I'm the only one, but I feel the network is really unstable because the latter part of what you just said, it was just going on and off and off. Yes, please.
Oh, okay. Can I hear from other people? How do you assess my?
Sometimes
Same story.
the network is not that stable.
We are all facing the same challenge.
The same challenge, right?
Yes, so
Yes.
Sir, please, you are going fast.
I'm going fast.
Yes, sir.
Maybe it's the network.
Yeah, it's the
Anyway.
network.
Is the network will just move the thing as fast as you can hear. Anyway, I don't know, but what I have observed over the years, over the period, is that when they fix lectures for Sunday evening, normally the network is so bad, it doesn't help, especially in the evenings. The network doesn't help at all. It's the first time we are having medical nursing around this period. It's the first time. It's the first time. Gideon, your hand was up. Normally, medical nursing is handled during the Saturday periods. And I wonder this time around how they brought the medical nursing Sunday in the evening. And around this time, the network is so bad. So bad. Yes, Gideon, your hand was up. Let's hear you. Yes, Rita.
Any class there, so to my suggestion, if we can fix this one day, if only it will work. Thank you. Hey.
Rita, you have raised up your hand. Let's see you.
Listen, I was saying 2 to 4 on Sundays. There is no lectures there, so if only we can, if it's possible and convenient for you to fix it there. 2 to 4.
That would be a bit earlier, right? That would be good. So I will speak to the IT people. Right after this lecture, I'll call the IT people to reschedule the meeting from 4 to 6 to 2 to 4. So we don't have network challenges.
Okay, sir.
What do you think?
Yes, that's fine, sir.
Yes, it makes sense. Because when it's getting to the evenings, the network gets so bad. So today, let's manage. I will speak slowly, but if you think you are not getting me well, raise up your hand and I will recapture what I have said. Like the one from Takra, they just alerted me. So I'll repeat what I said. Yeah, Blessed, let's hear you.
Sir, please, it's rather 2:15, not 2. Sir. Network.
Please, let's move on. 2:15, 2 o'clock, the same thing.
raised up the hand. Yes.
Yes,
That raised up. Yes. So I will speak to the IT, and then we would together think, and then move the lecture from 4 to 6 to 2 to 4, and that will make sure that we have a very smooth network for teaching and learning to go on. Okay. So I will speak slowly. If you don't get me well, raise up your hand from your end. If there is any hitches to my voice, if there are any fading from my voice, just let me know so that Benjamin, let me hear you, Benjamin.
Hello, sir. Please, there's one Georgina Boateng. Can you please tell her to mute her mic? He's literally disturbing the class. The network is not good as it is, and we are trying our possible best.
And
Georgina
she is also
Boateng, please mute your mic.
Georgina Boateng, right? Okay, let the IT people give me the access. The IT people need to give me access so I can control the platform. So let me call them. A lot of people have left their microphones unmuted. Those who joined later, they have unmuted their microphone. Thank you. I don't know what. Yes, I don't know what Yabua Frimpong Yabua wants to say. Your hand is up. But anyway, we can move on. Let's move on. Otherwise, we will never move on. So let's move on. If they will talk, fine. If they will keep quiet, that's fine. That's why I want them to use their name so we can identify them and discipline them. Anyway. So we are, yes. So let's move on.
I think that I wanted to make a humble suggestion because this thing has started since the first day we started the lectures. There has been a complaints, and some of the lectures have to even sack people from class. Please, we should all consider ourselves to be an adult, and we don't have to do these things for a lecturer to be talking as if we are now starting from page. So to me, I think that if there is a way we could also use at the place where we have written our written our names and our index number, if there could be a way that we also, or we can also identify our centers so that the rest will deal with those people who are misbehaving in the class like that, because we cannot continue using a precious time that has to be using for lectures to saying stop talking, stop misbehaving. We are not children, we are not kids. So I don't know if you can identify our centers with attached to our names so that the center reps can discipline their members, because it looks as if those who are innocent, we are counting them among all of us, and you couldn't know which center students are misbehaving like that.
Okay.
Don't bring in centers. It's individual. Okay. Don't add centers.
Okay, so it's okay. It's okay. Let's move on. We'll deal with these issues after the lecture. So let's otherwise we waste our time on these things. So let's move on and make sure we do. Yes, you see, we have used 1 hour for.
Stop talking. Only 1 hour.
Things have gone so far. Let's the remaining one, please. Each and every patience. Yes, you have joined, and I think this is not something so difficult for you to do. This is not difficult at all. That once you join, mute your microphone. That's simple. So you let us move. So once now he has given me the access, so I can now mute everybody. If I mute you and you unmute yourself and you disturb for 3 times, I'll remove you from the list. So you can't join again. That is how the punishment I'll give to some of you. If I mute you, then you unmute yourself and start talking. I mute you for the 3rd time. It means you have intentionally wanted to disturb the lecture. I'll remove you from the list. That's all. Okay. So LVD, as I explained earlier, that some people did not get me well, is that you are losing fluids from the body, and the fluid that you are being, or that is being lost, is lost in the same proportion with respect to the fluid and then the solids. So if you lose 20 mils, you are losing 20 grams. So at the end of the day, whatever fluid remaining with respect to the solid is the same. That is what we mean by FVD. But just remind you that FVD is a decrease in intravascular and interstitial fluids. And FVD is common, and this can result in serious fluid imbalance that can result in hypovolemia. But before I proceed, I need to explain to you intravascular and interstitial fluids, or a compartment. There are body compartments in the whole body system. There are various compartments. And the major two compartments here, we have the as I mentioned it, you can jot down some notes. I have taken my time. I'm not moving that fast, and I make sure I repeat so that those who doesn't or those who don't get me will still get me again. So we have major two compartments here in the body. We have extracellular and then the intracellular fluid compartment. So these two compartments make up the whole body system that the body or fluids are contained. But first, we have the extracellular fluid compartment. With the extracellular fluid compartment, this one, fluid are lost from the extracellular volume before, if you don't put brakes on it, then it extends into the intracellular fluid compartment. So the first, for example, if a child or an adult start vomiting, the vomiting that you are being experienced or that's being taking place, as in addition to diarrhea, you are losing these fluids from the extracellular fluid compartment. So once you lose fluid from the extracellular fluid compartment, if you put brakes on it, then the intracellular will not be affected because you have put brakes on it, you have taken medication, and you have rehydrated yourself. But if you ignore and the vomiting continues, and then the diarrhea continues, then the fluid that are lost from the extracellular continue and it will involve the intracellular. That is where the patient starts experiencing signs of complications. Then the patient will tell you that I feel crampy pains within my muscles. Then the patient will start going through dizziness and so many signs and symptoms. Then you have to experience that sign of hypovolemia. The BP start dropping. The various two compartments has different components. The extracellular compartment is made up of other three subcompartments. We have the intravascular. The intravascular is the blood vessels, the capillaries that blood moves through. So once you see blood capillary, once you see arteries, once you see veins, once you see fluid moving or blood moving through this capillary, this compartment, then it is within the extracellular compartment. So with the extracellular compartment, we have intravascular compartment. That is one of the compartments under the extracellular compartment, which involves blood vessels, arteries, veins, and capillaries. Then we have another compartment under the extracellular compartment, which we talk about or we explain as the tissues, fluid that are found within the tissues. You see, Priscilla Theodora O2. Priscilla Theodora O2. Then we have, let me see, Priscilla, you are disturbing us. You just joined and you came late and you are still disturbing us. And then we have Julia. My focus. I am in the midst of explaining very important points. Then I have to stop. So many of you know. Those class, you talk once and that is all. Nobody will disturb you again. But you, those who have listened will listen. Then the rest will come and join and continue to misbehave. Anyway, let's move on. So we have the extracellular compartment that involves intravascular, and the interstitial. Interstitial, that is fluid found in between the cells. We have various cells that is within the body, and fluid that are found in between the cells are called the interstitial fluids. So apart from the intravascular, then we have the interstitial, that is the second compartment. Then we have the smaller capillaries, or the smaller spaces. Those we have to call the transcellular fluid compartment. So the transcellular fluid compartment example is the cerebrospinal fluid that normally is found within the vertebral column. We have the tears that comes from the eyes. We have various fluids that are found between the joint of the body. So these are fluids that are found within the smaller spaces. So they add up to the third space called the transcellular space or transcellular fluid. So with the extracellular fluid, we have the intravascular, which is the first one, containing the blood vessels, arteries, veins, capillaries, and so on and so forth. Then we have the fluid that are found in between the cells. We have cell 1, cell 2, cell 3, cell 4. So there are fluids that are found between cell 1 and cell 2, and fluids that are found between cell 3 and cell 4. Those are the fluids that when you inject, the needle go into those spaces. If the needle enters the intravascular space, it will draw blood, and then the professionals will say that push the blood back and re-inject again. You don't need to inject within the intravascular. So once you are injecting, the needle goes into the interstitial spaces where there are interstitial fluid found. So we have 3 major compartments under the extracellular compartment, and we have the intravascular, interstitial, and transcellular. Then we have another compartment. So this extracellular compartment makes up 1/3 of the total fluid volume found within the extracellular compartment. 1/3. Then we have intravascular. That is fluid found within the cell. So once you take a cell, you enter into the cell, and we have 2/3 of the total body fluids found within the cell. So once you start vomiting, you start having diarrhea, fluids start drawing out of the body from the extracellular spaces. So you talk about the interstitial space, fluid move out of that space, then transcellular fluid move out of, then we have the intravascular space, fluid move out of those spaces. So those 3 spaces start losing fluid. If you don't stop it and then it continues, then complications start setting in. Then the fluid within the intracellular also start leaving. So the patient start complaining that I have cramps within the body, my body is pulling here and there, then complications set in, and the person can even go into hypovolemia. So those are the compartments that we are going to use to explain how fluid move in and out of the body. So we have the intracellular, and then we have the extracellular. The extracellular contains 3 various compartments, and then we have the intracellular, which makes up the 2/3, and the extracellular makes up the 1/3. Okay, I haven't said anything, just explain the compartment. People hands are up. Let me hear you. Yes, Adams and CODeL or something. Yeah.
Sir, good evening.
Good evening.
Yes. Please, I was thinking whether you were reading from the slides, because it's tagged on the definition of fluid volume deficit. So I wanted to know whether it's from my end or you did it that way.
Those explanations I'm giving, those explanations are not on the slide. My slide is just one slide. I am explaining to you. I meant if you look at the second paragraph, it's talking about intravascular, and I'm going to do a lot of explanations. I'm telling you, my slide is just a skeleton. And once I post one slide, about 3 pages of explanation come. So that's ready.
All right, thank you.
Get ready. I'm telling you. So you need to pay attention and listen. Once I post one slide, I will speak volumes to explain it. Explaining is, so when you read and you come across intravascular and interstitial, you would know that those are the extracellular fluid compartments. So we are talking about the extracellular fluid compartment. Then when you come to intracellular, then you know that we are talking about the 2/3 of the body fluids. But they are not here. Otherwise, I will give you volumes of notes, which is not PowerPoint now. Now it's Power Notes. Rita and Akosia, yes. Akosa, sorry, Kenneth. Yes, Kenneth Akosa. I don't know whether it's the Kenneth Akosa I know already. No, Rita, your hands are up. Let me hear you.
Sir, please, I wanted to be clear on the major fluids, body fluids that you are talking of. I heard that you were saying that we have the intracellular being the fluid within the cells. The extracellular is outside the cell, but the intravascular fluids, that's what I'm not getting it.
You are not getting it. Okay. Anyway, I said take your book and make your own notes out of this, because anyway, I need to take once again and listen carefully. Yes. 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 Let me hear the other people so that I can explain. Yes, of course, I'll mute your microphone and talk. Kenneth, unmute your microphone and talk. Otherwise, nobody will hear you.
All right, sir. Sir, this is a humble suggestion.
Okay. Kenneth, let's hear your suggestion. You have unmute.
Since the slice is just a skeleton, can we humbly have a book that will support the slice? You've explained about so we can get you.
Mr. Kenneth, I think he's trying to tell you that the university does not allow handouts. So he cannot make any. That's why he has given you reference books that you can read from the internet.
Please, let's hear from the lecturer himself. You can tell this.
Yes. Hey.
You are saying A.
After causing the confusion.
You are saying A. Keep on asking for the book.
The person is flowing. You are bringing suggestions in the middle. Suggestions are supposed to be given at the end of.
Can't you?
Please, people think when they buy books,
It's okay.
then they've secured
The
their
noise
pass.
is too much. It's okay.
Let me have
This is not very unprofessional.
book. We need the
It's okay. It's okay.
Yo, come.
Alright, guys, it's not about we have a lot to say, but the truth of the matter is, I think when they are doing the introduction, if we are
Master
just
is back,
careful
so
with
please
all
let's
the
listen.
lecture. Hello, guys. I just want to say something. If we have been very observant about all the courses that they have introduced to us, during the introduction, there is always a section that they always recommend some things. So I beg, some of us, we need texts to learn from. You can just take a name of the book, or let me say the writer of the book, then you go to any bookshop. You get some to buy. Some here. So if you ask a book and then the lecture make it a compulsion for us to buy, Charlie, it's not easy to get it. So we beg. And then
My
I
brother,
just
you are
want to
talking too much.
say
You are
this.
also talking too much.
My brother, it's okay. It's okay. The talking is too much, my brother.
Some of us, we have 4 kids, 5 kids.
Hey.
How?
Now the men panado door. What else key?
It's mine is 6, and I'm pregnant for the 7th one. Please, can you keep quiet?
Sarah is having 5 kids.
Oh.
You can set that.
Please. Some of us are stupid, but we are not that.
Listen, guys.
So
Good evening.
Someone said,
Good evening.
Hello, please.
Let's listen.
All of you stop
Hello.
making noise. Please, all this thing we are saying, there's no sense in that. We are just talking anyhow.
Hey,
There's
no sense. Who is that? Who is that? Who is that?
I am one of you. I am one of you. I didn't come
Who
from
is
the
that?
beginning.
Master, be very careful.
I am one of
Be
you.
very
Let's just
careful.
be quiet and
Hey,
listen.
it's okay.
Retract that statement. Retract that statement.
Hello, can you hear me?
Retract that statement. What are you trying to say?
Mr. Ernest is a very good person.
People are just
disturbing. Keep quiet and let's wait for him.
I will take over.
My guy, come and retract that statement. You can't say there's no sense in this.
He's sorry.
Mind your language.
Let him
come out.
But if everybody is
Let him
talking,
come
you
out.
only understand what they are saying.
Cornelius, put your hands down. Cornelius, put your hands down.
will come and also repeat what Akosa has done. We are saying it and you are telling us there is no sense.
There's no sense.
Not only Akusa, a lot of people do that. So it's not only him. You don't have to stop
Hello,
that.
please. I am the one who said there's no sense in whatever we are saying.
Please, those who haven't paid your school fees, keep quiet.
Everybody is talking.
Those who haven't paid your
Nobody will
school fees,
understand
keep
what
quiet.
is happening. That is why I said, as we are all speaking, there won't be any sense in that. So let's just behave ourselves.
You use that statement again. Don't say that.
You can't say that. Use that word,
What are you
my
trying
boy.
to tell us?
That is not what you meant.
Huh?
Okay, I have corrected my word.
Retract that statement. I repeat, retract that statement.
It's okay. He said he's sorry.
Yes. Apology accepted. Sure.
Sorry, being free, we don't accept it.
I'm right.
Let's
right.
Sorry for
Hello, class. Please.
It's being recorded,
so please.
Hello. Let's exercise patient.
Akosa, let it be your last, first and last. That is all.
Hello.
Be very careful.
Hello.
Please, are we aware the tutor or the lecturer is still recording our voices?
Have you said anything wrong, please?
No, we haven't. But please, I think that the fact that he is still recording it means that he is not up from the class. And I don't think it will be the best way for us to do all these discussions whilst he is still on the platform. And I think that maybe he is recording this for our own benefit. He could give it to some of the reps for them to send it for us to also listen it again and get whatever information that he was giving us. So with we doing these discussions here, do we think that when this recording is being sent to us, we can really have time to listen all these conversations we are having here? Please, I am begging.
We never said anything bad.
We've never said anything, but we are just expressing
Neither
ourselves.
do we insulted the lecturer. We're only sharing
So
our
what
mind.
is wrong about this?
Yeah, we don't.
I am not saying we have insulted the lectures or we are saying anything. But what I mean is that
since we started the lecture, this has been happening.
No, we need to caution ourselves. We don't want any boosts again. So
and
instead of
you
asking
think
for boosts, asking for
we
want to caution.
you don't have anything to do, let me play music for you and you all be listening. So that will be
We
quiet.
can be at least expressing our views whilst the lecture is knowing. What is wrong about this? Is it not adult education?
Please, it's back. Oh, keep quiet. Someone was asking the difference between the fluids, and I'm here to discuss it. So let's keep quiet.
Very good.
Hello.
You can go on.
Body fluids. That's the intercellular.
And extracellular that the tutor was talking about.
Please, can I?
He was saying that we have two major fluid compartments. That's the intracellular and extracellular. So, and he said that with the extracellular, you have three other subsections of it. That is the intravascular, interstitial, and the transcellular compartments. And he said that
that's perfect.
Intravascular compartment contains the vessels, like the capillaries and others. And the interstitial are those that are found within the cells. And the transcellular are the fluids that are in the special compartments, like the synovial fluid, the cerebrospinal fluid. And he also said that the extracellular fluid contains 1/3 of the total body fluid. After that, we came to the intracellular, and he said that one also contains 2/3 of the body fluid. That's where one of our brothers raised this and the network.
Thank you very much.
That's right.
That's perfect.
That's right. Thank you.
Thank you for the clarification.
You've done
so
well.
The sister can take note again, please.
Oh, please take it again, please.
Question. Which one
The lecturer
contains
was saying that we have two major fluid compartments. And with the two major fluid compartments, he made mention of intracellular fluid and extracellular fluid. And he went on to say that the extracellular fluid have three other compartments. That is the intravascular, interstitial, and the transcellular compartment. So we arrived that the intravascular contains the capillaries and the fluid within our vessels, like the blood and those stuff. And we also made mention of the interstitial being the fluid within the cell, found within the cell itself. And the transcellular is the fluid in the special compartment. That is the PSM, the synovial fluid. That fluid in the special compartment. That's made up of the transcellular. So these three all comes under the extracellular fluid. which make
Yes.
up 1/3 of the body fluid. That's what he said. And he
Please
also said
kindly
that
use
when you are
compartments, not fluids, extracellular compartments, please.
You can
extracellular
also explain your own, boss.
I'm just cautioning him.
Thank you, boss. Thank you for the
Yes, it's extracellular compartment.
extracellular compartment.
Yeah.
And he also said that the intracellular compartment, that's where we get all these problems started. Said it's made up to 2/3 of the body fluid. That's where we were talking. Let's equal. If somebody have other challenge, bring this up and discuss it.
Okay.
Thank you.
Hello, Black.
Yes, Akosa.
Yeah. I want
Why Akosa? Oh.
Akosa, any question?
Hello, please, I want to know, did he say that the interstitial one is, what I heard was the interstitial fluids, they are outside the blood vessels, but between the cells. That's what I heard. And that's what I
That is exactly right. It is the interstitial fluids are found in between the cells.
Please, one at a time.
Please, I said that what I heard was the interstitial fluids, they are outside the blood vessels, but between the cells. That's what I heard.
Yeah, that is it.
But he said we have fluids between cell 1, cell 2, and cell 3 and cell 4.
Both
Let me give you an example. It is in between the cells.
I want a clarity. Which one is the 1/3 and which one is the 2/3?
I heard that it's
Which
in
one
the
is the
tissue.
2/3 and which one is the 1/3? Please, I need a clarity.
The intracellular is 2/3 and the extracellular is 1/3.
1/3. Okay, thank you.
And to add on to, he said we don't inject in the intravascular space because if you do that, you can draw out veins. So the best place for injection is the interstitial fluid. And also,
Giving IM injection, you don't inject in the vein. When you are giving IM injection, that's where the extra intravascular fluids are found.
Okay, so when he was talking about the two major fluid compartments too, he said with the extracellular fluid, in case in situations where you are not feeling well, you lose fluid from the extracellular parts of the extracellular compartment. That's where you lose fluids. But if measures are taken, if you are giving medications and other things, it can be stopped before it gets to the intracellular space. Please, do you get it?
Yes, madam. Yes.
Thank you.
You are welcome. Any question again?
Yes, madam, is good. He has said it all. Good.
Okay.
Hello, please take it again.
Please, what again? Can you be specific?
The intercellular and then the extracellular.
Intracellular and the extracellular.
Yes, please.
Oh, okay. We said that the compartments are made of two. The ECC, which is the extracellular compartment, and then the intracellular compartment. And the extracellular compartments are composed of three fluids, of which we have the intravascular fluids, which we said it composes of the blood vessels, capillaries, and the blood plasma. Those are the intravascular fluids. Then we said we have the interstitial fluids, of which they are fluids found within the cells. And then we talked about the... is anyone talking, please?
You said within. I wanted to correct. You said it's around the cells.
Hello.
It said it's between the cells.
In between the cells, not around.
Not within.
Around
cells.
Class.
Yes.
Hello, class.
Yes,
sir.
I have tried so many means to join. Please, just let's say it's almost raining in Kumasi here, and the weather is so bad. That is why over here the network is so bad. So I wasn't able to log in. And now I think I'm able to log in. Should we have the lecture some other day because the weather is so bad?
Yes, please. Yes, sir.
Because
Okay, sir.
on logging
Yes,
on and off
please.
on and
Yes,
off. And
please.
Koforidua rep has just sent a link for you to join the WhatsApp page. I have joined. So please, she's going to send it to the various class reps at the various centers so that you can join, so that I can put on the channels and everything, the course outline, everything, so that you can access them. Yes, but before we leave, somebody was asking, I think Kenneth was asking about a book, and I said the university frowns on making a book.
We have solved it. We have solved it.
Yes. So please.
We've handled him, sir. We've handled him.
Yes. So please, no book issue here. Let me have my peace of mind. Yes.
Yes, sir. God bless you.
Yes. So nobody will tackle me there. So please.
We are here for you.
Yes. The notes I give you, I give detailed explanation, and there will be recordings in addition to that. So there are recordings from the IT that they'll record it, and then they can put the recording for you to listen to the recordings after the lecture. Okay. Then another one is that when should we meet again? Because today it looks as if our time has been wasted. We couldn't have any meaningful.
Sir, at your convenience time. Yes. At your convenience time, you can give us a time so we can join.
Most of you might be working, and I don't know when you will have time to meet, so that we can at least do some hours to make up for the day. I don't want us to lose the hours like that. The network is bad. It's not going to help us. I don't know.
If you take the working into consideration, then I think we will not get that time, because
we will not meet.
Don't take the working hours into consideration, because some will be going for morning, others will be going afternoon, and some will say I'm going for night.
You know the course is CODeL weekends. So weekends, I don't want to have any lecture within the weekdays. You understand? That is it. And I don't know.
Hello, sir. Sir, please, I want to
Sir, please. What about Friday morning or afternoon? Because Friday we start lectures on, I think, 7.
But it's still the same thing. People will be going to work.
Sir, please, I think if next week we are able to start on 2:15, then we will zoom in 4, 5, 6, then we close. That one we have time to cover if the network becomes good.
Okay. So I think yes.
Yeah, I also want to suggest that why don't we fix it at Saturday dawn, like 5, then we close at 6:30.
No.
Massa, that will not help.
No.
Saturday lectures are too much, so we can't add it.
Please listen.
Massa.
It's a suggestion. So that's his map. By that time, the IT people will not be in to even connect us. So the IT people
suggest that let's do it between the 2 to 4.
So next week, I think we can start at 2:15 or 2 o'clock.
Yes.
And then we can have more hours. I will tell the IT people that we want to fix in the hours we lost for today, so we can fix in next week, God's willing, if we have a very good weather.
Thank you, sir.
Trust me, the time is going to be 2, not 4 again next week.
Okay.
Yes,
Thank you, sir.
Thank you, sir.
Thank you all for your attention.
Thank
you, sir. Thank you, sir. Good night.
Bye.
So all the best. May the good Lord bless everybody.
We don't want any suggestions in the group.
Bye-bye.
So we're going to meet again next week.
Man, don't be bringing your horrible voice like that. What is that?
Weekend.
Thank you, sir. Good night.
Okay. Bye-bye.
Please just end the Zoom meeting for us.
Let the ladies thank the master. What is that?
They just have to come. It's normal.
Hey, please just end it for us.
You
They
guys should
just have to come.
stop
It's normal.
using your horrible
Don't
voice to thank
agree
the master.
and come and
Because
complain.
she's on why.
You agree right now and then you come and complain later.
Go and learn on your own.
Tell
No
us that you are
suggestions.
People
tired.
raising up their hands. I don't know what they want to ask. Sister has left.
Allow them, allow them.
Let the woman thank the lecturer. You guys.
Allow them, allow them.
Now we are going to do cross matching here.
Not easy. Yes, good to see.
Because I can talk now, Charlie.
Tell us you are tired.
Rockstar Akosa. Akosa is my friend now.
Akosa, good night.
Danielson, please, if you can explain what you were saying to us,
Akosa, good night. Good.
All the best.
Danielson.
Akosa, I want to be your friend. Akosa.
He's already my friend. We can link up.
We for link up. Every day suggestion. We don't want any suggestions again.
I don't know where they
You've roasted Akosa today. It's okay. Let him be.
Akosa, good night. Good night, my good Who is this? Thank you, DJ. Thank you.
Oh yeah, nana doye woda, onyami yo. Oh yeah, yeah, oh yeah, yeah, oh yeah. Oh yeah, oh yeah, oh yeah, oh yeah. Oh yeah, oh yeah, yeah, oh yeah. Oh yeah, nana doye woda. Oh yeah.
DJ, flow.
Okay.
DJ, play me Akosa the best.
It's worship time. Only woman,